Here are 8 types of abnormal menstruation and their potential treatments. 1. Amenorrhea, absence of menstruation. 1. Description: the absence of menstruation for several months or even years. 1. It can occur due to pregnancy, breastfeeding, or menopause, but also from stress, low body weight, hormonal imbalances, or conditions like PolycysticOvarySyndrome, PCOS. 2. Treatment: for hormonal imbalances, birth control pills, hormone replacement therapy, or medication to regulate the menstrual cycle. For stress or weight issues, addressing stress management and maintaining a healthy body weight. For PCOS, medications to regulate hormones, such as metformin or birth control. 2. Menorrhagia, heavy periods. 1. Description: excessively heavy bleeding during menstruation, often with periods lasting more than 7 days. 2. Treatment: nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen to reduce bleeding and discomfort. Hormonal treatments: birth control pills, IUD, intrauterine device, or hormonal injections to regulate bleeding. Surgical options: in severe cases, procedures like endometrial ablation or hysterectomy might be considered. 3. Irregular, infrequent periods. 1. Description: periods occurring less frequently than usual, typically cycles longer than 35 days. 2. Treatment: hormonal treatments, birth control pills, progestin therapy, or an IUD to regulate cycles. Lifestyle changes: maintaining a healthy diet and weight, reducing stress, and managing exercise routines. 4. Dysmenorrhea, painful periods. 1. Description: severe cramps and pelvic pain during menstruation, often accompanied by nausea, fatigue, and headaches. 2. Treatment: NSAIDs, ibuprofen or naproxen to reduce pain and inflammation. Heat therapy: using a heating pad or hot water bottle to alleviate pain. Hormonal birth control, to regulate periods and reduce pain. Lifestyle modifications: regular exercise and stress management techniques like yoga. 5. Menorrhagia, or regular bleeding. 1. Description: bleeding or spotting between periods or at irregular intervals. 2. Treatment: hormonal therapies, birth control pills or IUD to regulate the menstrual cycle and reduce bleeding. Treatment for underlying conditions: if caused by fibroids, polyps, or thyroid issues, those conditions may need treatment with medication or surgery. 6. Polymenorrhea, frequent periods. 1. Description: periods that occur more often than usual, typically less than 21 days apart. 2. Treatment: hormonal therapy, birth control pills, patches, or hormonal IUD to regulate cycle length. Treatment of underlying conditions, such as fibroids or polyps, which may require medication or surgery. 7. Spotting. 1. Description: light bleeding or spotting between regular periods, often a few days before or after the menstrual period. 2. Treatment: hormonal regulation, birth control or hormone therapy to stabilize the menstrual cycle. Treatment for infections or conditions: if caused by infections, such as bacterial vaginosis or sexually transmitted infections, STIs, antibiotics may be necessary. 8. Menopause-related changes, perimenopausal abnormalities. 1. Description: during perimenopause, women may experience changes in the length, frequency, and flow of their periods, including heavy bleeding, missed periods, or spotting. 2. Treatment: hormone replacement therapy, HRT, to help manage menopausal symptoms, including irregular periods. Non-hormonal treatments: antidepressants or other medications for mood regulation and hot flashes. Lifestyle changes: a balanced diet, exercise, and stress management to help cope with perimenopausal symptoms. General tips for managing abnormal menstruation. 1. Monitor your cycle. Keeping track of your cycle and any unusual symptoms can help your doctor diagnose the cause of abnormal menstruation. 2. Maintain a healthy lifestyle. Diet, exercise, and stress management are key in maintaining hormonal balance and regular menstruation. 3. Consult a healthcare provider. If you experience abnormal menstruation, it's important to see a doctor for proper diagnosis and treatment. By understanding the causes of abnormal menstruation and seeking appropriate treatment, you can manage your symptoms and maintain overall reproductive health.